All right, it is 5 o'clock on this Thursday, the time we get together just about every day to get an update on our battle with this one in every 100-year pandemic, and to remind ourselves that we will get through this and we will get through it together. Say it with me. Every day we've got to say it. Why? Because it continues to keep the faith and to make sure that we are mentally and emotionally strong. Because again, we know we are going to get through this. We are going to get through this together. One last time, we are going to get through this. We are going to get through this together. We're going to get through this because we have been up against big adversaries in our past here in Kentucky. We have faced tough times, and we have always come out on top, and we are going to succeed against this adversary as well. We are going to do that because we will continue to remember the 10 rules that it takes to defeat COVID-19. Number one rule, healthy at home. I'm going to continue to say healthy at home until we defeat this virus. So get ready. But healthy at home, make sure that we reduce our contacts. Even when we're going to work, and make sure that we come home right afterwards. The fewer contacts that we have out there, the less likely we are to get the coronavirus, the less likely we are to spread it. The more we can keep it tamped down, which means the more we can do in our economy. Avoiding crowds and gatherings. That's whether you're trying to be healthy at home, healthy at work, or otherwise. Practice social distancing, at least 6 feet. And remember, if you are in public, this helps protect other people from you. It's a small thing that you can do to make sure if you're asymptomatic that you don't spread this virus to somebody whose body maybe can't handle it. It's a small price to pay to protect your neighbor when their health and even life might be on the line. Knowing when to seek care, kycovid19.ky.gov had a group today say they needed specific guidance on a certain sector of our economy that's reopening. It's already up there. So make sure you are going to this site. And you know what? Even if you're not going to a place of employment, but you want to know when retail opens up, for instance. I think that's May the 20th. What type of precautions have to be taken? Go to the website and look at it. Hopefully it will show you that we're doing this in a safe way. And if you need to go to a retail store, maybe have a little bit more confidence in the safe experience that it should be. Wash your hands and surfaces. We can't let up on that. Apply for benefits. So tonight, approximately 7,500 additional claims from March are going to be cleared. That's going to get those claims down to about 14,000. Of those, we believe a number of them are duplicates, and then there are employer protests, and there are probably some fraud claims. So those will be the last batch, and they'll be a tougher batch to get through. But excited about 7,500 additional claims from March that ought to be cleared up tonight. I know people have been waiting far too long. I agree. You've been waiting far too long. Prioritize your mental health. Make sure you're getting exercise. Make sure you're connecting with people through technology. Make sure you're taking care of yourself. And I think I stopped saying this. Make sure you're asking other people if they're doing okay. It's a very small thing. It lets them know that you care about them, and it makes them question, am I doing everything that I need to do to take care of my mental health? In a few interviews, I'm asked that. It's a very hard question to answer because none of us are okay. None of us are. We're in the middle of a worldwide health pandemic. We wouldn't be normal if any of us were perfectly fine. But we're getting through it, and we got to stay strong through it. Don't travel and report noncompliance. So we always talk about the 10 rules plus one. Please fill out your census. Please. We slipped from 13th to 14th. We do have, I believe, 6 of the top 10 cities in the country by percentage to have filled it out. There is one small North Dakota town that doesn't have enough people. It shouldn't count. They're at 100%. I'm hoping we can have at least one of ours that is close to get there as well. So please fill out that census. It is going to help. We also, every day, ask you, because we are Team Kentucky, and we're so many days into this, but every day is just as important to protect each other's health. If we take a day where we don't do the right thing. Somebody gets harmed. And as we hear some more noise out there about folks that just don't want to do this anymore, showing the right behavior, putting up the right choices, and celebrating them, absolutely celebrating them, is helpful in creating that good social pressure to make sure everybody is doing the right thing. Remember, just one person making a wrong choice or refusing to see how serious this virus is could potentially harm so many. So let's see what we have today. So this, one of our kiddos that is getting fed thanks to our public schools, that there might not be in-person class, but they never shut down. They've been working hard throughout all this, whether it is NTI or delivering millions upon millions upon millions of meals. Our schools have always been an important place of learning, but they have done so much to help us survive this pandemic. We should all be grateful to every member of every school across Kentucky. Oh, this is a 21st birthday. Man, you want to talk about a milestone that this changes. A 21st birthday. I'm not going to tell any story about mine, but this, again, is a sacrifice that people are making. Making sure that even in moments where we really want to be out, that we do what's safe. But I do want you to look at this picture for a minute. Look at how happy everybody is. And just because we're making sacrifice, just because we can't do things right now the way we used to, they're all experiencing joy. Even in the darkness, there is joy. And so I want to thank Mackenzie for sharing a little bit of her 21st birthday with us. Happy birthday. All right, this is some of the drive-through testing that has, with the Kroger site moving out of Bowling Green, has stepped up to make sure that the local testing is still there. This is a partnership between a number of folks. We've worked with them directly, but this is one community coming together, getting the resources that's needed. And this whole region is hit pretty hard. And it just tells us we can't let up, even as we reopen. It's still very serious, but I got to tell you, we have so many of these going on, so many communities coming together and doing what it takes. All right, this is one of our graduates. Graduation's going to be real different this year. It's going to be probably more different than any graduating class that I can think of. But I'm so proud of this graduating class, not just for their accomplishments, which are great, not just for their future, which is bright, but for the sacrifice that they are making. When we looked at Philadelphia versus St. Louis all the time, remember, it was a big parade that caused the spike in Philadelphia that ultimately caused that large loss of life. Knowing that we can't have a large in-person graduation because it undoubtedly would cause the same thing, that's a sacrifice that these graduates are making. And to start off what could be your professional career, to go out into the world knowing you've done something heroic just by giving something up, that's pretty special, and I hope it's a lesson and a value that our graduates will take with them. And their class, I hope, is the only one, certainly in my lifetime, that will ever have to make this sacrifice. They'll have something to talk about that none of the rest of us will. And this is the National Quilt Museum in Paducah. It's an incredible place. Paducah's downtown has had such a resurgence. It's an incredible city, and we're very proud of their work, but we're also proud of the compassion that they and everybody else are showing. Did you ever think you'd see so many green lights out there? When I think about it, yes, if I would have known we were going to ask people to show compassion for one another, this is the type of people that Kentuckians are. It's one of the reasons we're defeating this virus. I believe our compassion, our love, the amount we care about each other is stronger than this virus. We just got to keep it up. All right, and now we have one of those videos that I love showing. It's a video of another person who has recovered from COVID-19. And it has a soundtrack. Pretty incredible. And from a town where there's been so much loss, and a county that there's been so much loss, to be able to celebrate the win, the life, that's pretty special. And thank you to all that staff in there that has been under such stress and pressure, dealing with so much, probably crying through their breaks. I know that's a moment that they all wanted so badly, and I hope that they share in that moment. All right, we've had a number of people step up and talk about our team, Kentucky Fund, and encourage people to be a part. This is just another way we're going to be able to help people out there as we rebuild, knowing it's going to take a little bit longer, whether it's small business or people paying off rent or keeping their utilities on, not just now, but as we start reopening. And we've had different folks. This is one of my favorite. This is Weta Michael, who is a restaurant owner, Holly Hill Inn, and many other endeavors that has always been a voice and a spirit of our community, volunteering for just about every great cause across Kentucky.
Hi everybody, this is Weta Michael, and I'm coming to you from my home in the midst of this quarantine. So many people have lost their jobs, many more have contracted the coronavirus, and even some in Kentucky have sadly lost their lives. But together we can make it through this period, and we can rebuild. As Team Kentucky, we have started a Team Kentucky Fund. It's super easy to donate. You go to donate.ky.gov. I just donated $19, and I'm challenging everyone in Kentucky who possibly can donate to do the same. Every penny counts. You can donate $1 or $1 million. It'll all go to people who are suffering during this quarantine period. Together, we can make it through this.
We appreciate Weta and everybody else. We have had donations of $1. We have had a donation from the Kentucky Colonels of $1 million. And we've had a lot of $19 donations as we defeat COVID-19. All right, we're moving the numbers up now each time. So today we are reporting 208 new cases of COVID-19. When we go through our audit, which we normally do, weed out duplicates and the rest, it brings our total number of cases to 6,129. 10 of those are probable. The rest are lab confirmed. And those are out of a total number of tests of 81,391, that we know that number is artificially low. Just like we knew that, and then suddenly there were 17,000 more tests. It's that we know we have labs out there that aren't reporting their negatives. So we're getting their positive cases, so we believe that number is accurate per the testing that's out there. But I believe that there are still thousands of negative cases, and we're going to be continuing to call through to make sure we get an accurate number of total tests. I know it's higher than this because we're tracking different tests that are administered each day, and they're much higher than that number. Ever hospitalized, 1,684 currently, 356. Ever in the ICU, 714, currently 199. This number's been creeping up. Remember, those are 199 Kentuckians that are fighting. And so let's make sure that we are thinking of them and that we want that same outcome that we saw in Mayfield, Kentucky. Total number of people recovered, 2,177. We want that to continue to grow. New cases by county, 45 in Jefferson, 41 in Warren, 22 in Fayette, 12 in Davis, 9 in Kenton and Logan. That shows you that this is regional, not just in Warren County and in Bowling Green. 8 in Scott, 6 in Allen, 5 in Butler, 4 in McCracken and Nelson, 3 in Boone, Campbell, Edmondson, Graves, Grayson, Henderson, Ohio, 2 in Adair, Barron, Bullitt, and Madison, and 1 in Boyd, Bracken, Floyd, Hardin, Harlan, Hopkins, Johnson, Metcalf, Muhlenberg, Oldham, Pike, Shelby, Simpson, Taylor, and Webster. And remember, we try to get this information out as quickly as we can. Sometimes someone is tested in a county and listed as that county. We're able to work that out as we go through it. Now, in the beginning, when we had fewer of these cases, if you remember, we read through, like we do on those that we've lost, on some of the demographic information about cases. And as I was looking through today's, I realized that maybe we've gotten, I don't think complacent is the word, but as we've looked at the devastation on long-term care facilities, maybe we started thinking that this isn't something that people of all ages can get. And I saw some comments from some different folks out there that this doesn't affect kids or that this doesn't affect young Americans. I'm going to read you just a couple of the ages from this 208 new cases. 39, 27, 36, 35, 26, 28, 38, 36, 26, 33, 32, 41, 34, 27, 25, 44, 43, 51, 39, 25, 41, 28, 25 years old, 27 years old, 39 years old, 24 years old, 29 years old, 22 years old, 35 years old, 14 years old, 15 years old, 3 years old, 34, 19 years old, 28 years old, 25 years old, 16 years old. So let's make sure that we remember that even as we're working to open our economy, even as we will have some people go back to be healthy at work on Monday, that is still out there and is still dangerous. And misinformation can be deadly. People believe that it doesn't apply to them and that they can't get it. Just listen to some of those ages and know that you've got to take steps to protect yourself. Just because we've been at this for months doesn't mean it's gone, right? We think we can do this safely. We think we can do it better, but it doesn't mean that it's gone. And remember, everything that you do to protect one another also protects people in your household, right? So if wearing this means I don't bring it back to my 9 and 10-year-old, I'm going to do it. If wearing this means that I'm not going to infect somebody else that could have a bad health outcome and even death, I'm going to do it. That's me protecting my family. That's me living my faith and living that golden rule. All right, today we also have to announce 11 new deaths. 8 of those are in our long-term care facilities. Each one is more than an age, a gender, and a county. But that's what we read every day. 94-year-old male from Butler, a 97-year-old female from Edmondson, an 89-year-old male from Edmondson, an 80-year-old female from Edmondson, an 86-year-old male from Edmondson, 62-year-old male from Butler, 73-year-old male from Warren, a 92-year-old male from Edmondson, a 78-year-old male from Jefferson, an 87-year-old female from Grayson, and a 66-year-old male from Hardin. Let's remember, these are 11 Kentuckians that we have lost. These are 11 families that are grieving, maybe more, with kids and grandkids. Let's remember that they're going to have to go through this at a time when they can't grieve the normal way. They can't lean on other people physically when they might need to. They can't give a hug to that brother or sister that they haven't seen in a long time, and that the way that they're going to have to remember their lost ones is probably virtually or over the phone. As a grandson of a preacher who ran a funeral home, I know how important being together those moments are. Both of my grandparents were laid to rest in their own funeral home. And I hurt for these families that, I hate to call that a normal experience, but don't get that normal experience. So let's please light our houses up green. Let's ring our bells at 10 a.m. Let's make sure we don't shortchange these Kentuckians simply because we get tired and don't recognize them the same as every other Kentuckian that we've lost. Maybe we even try to do a little bit more every day. More green lights, more bells being rung. Let's make sure that we're there for them. In breaking down ethnicity and race of total cases, 74.25% white, 13.72% Black or African American, 6.39% Asian, 5.5% multiracial. Ethnicity, 87.85% non-Hispanic and 12.15% Hispanic. Deaths, 78.85% white, 17.69% Black or African American, 2.31% Asian, 1.15% multiracial, and on the death side, about 98% non-Hispanic and 2% Hispanic. Let's pull up the long-term care facility slide. So here we are actually seeing less growth day to day than we were seeing in a while in cases, though we continue to see deaths. And that's not okay. This is not. This is what this virus does, but this is real loss, and I know everybody out there is working as hard as they can to prevent it. So 21 new residents, 6 new staff, 7 new deaths. In good news, FEMA, which we've been receiving more PPE from, is sending a 14-day supply of PPE to all 15,400 Medicaid and Medicare certified nursing homes. That's going to be a big help to them. For those that signed up for our program, we've been providing PPE right when they're about to run out, making sure that we help people at the time of the greatest need. But this should be a help to these facilities all over Kentucky. All right, so tonight we're going to start by talking about Phase 2 of our reopening. And it starts with Healthy at Work, Phase 2, with a date that's a little bit earlier, and that is May 22nd. May 22nd is the date we're going to work for to opening our restaurants at a limited inside capacity. That's a 33%, plus they can do unlimited outdoor seating if they can get the spacing that is needed. I know this isn't the capacity that our restaurants probably want, but the studies that we look at show that we've got to be really careful about this step. This allows it to be open for Memorial Day weekend, but please be careful, everybody out there, over this weekend. We know that we've got a lot of small business owners here. We want to be mindful of that to try to help them restart. We hope to gradually be able to raise that capacity, but this is the best compromise between public health and making sure we can restart this part of the economy. I will tell you that this date came in consultation with Ohio Governor Mike DeWine. We wanted to make sure that there weren't significant variances across that section of the Ohio River. He's going to open outside seating a little bit earlier. We're going to wait until the 22nd. It just gives time to get all of the supplies and follow all the guidelines that are needed. We're working to get that guidance out. In the very least, the 10 steps for Healthy at Work are going to have to be followed, and CDC guidance for restaurants can be downloaded as well for a start. We're going to go through the proposals that have come in, and we're going to get that out for comment from the association, and then we're going to get it up online just as soon as we can. But remember, these aren't easy to hit. And if I've heard one thing from businesses, it's they weren't expecting, even once they saw these, for it to be as much work as it is to get to the threshold level for it to be safe. And I'll mention one that I don't think anybody thought would be one of the ones that is truly saying whether people can go forward or not. It's the ability to do that thorough cleaning with the right type of disinfectants. Remember, this isn't just if you're a restaurant where you're eating, it's every surface that people can touch because the virus can spread, and it is multiple times a day. So again, if we're going to do this, we're going to do it safe. We're only going to do it if it means that we can keep this under control and we don't suffer more loss of life. So May 22nd, restaurants, 33% capacity plus outdoor seating. Then June 1st is our target for movie theaters and fitness centers. And this gives us time to work on the right type of guidelines to get them in the right type of shape. I will say that the movie theater, their association sent a really well thought out plan, and especially digitally how you can purchase your tickets now, may have some real technological tools to create the right type of social distancing in those facilities. All right, that then goes to June 11th, where we hope to reopen campgrounds, public and private. But again, this is one of the areas that we intentionally originally didn't want to close at all, but people weren't social distancing. We had to do this for the health and safety of people. My hope is now that Healthy at Home is muscle memory for us, that we all do it. We know that it's the world we live in, that we can do campgrounds safely. And June 15th, and this is a goal that we are pushing for. We want to have a safe plan for childcare, knowing that it is such a challenge for folks. I will tell you it will be significantly reduced capacity, and it will be very monitored to make sure that it's safe. We're working through that now. There aren't going to be that many kids in each class, if you want to call it, and they will be completely separate from others. So that's one we're going to work through. And then we're working on certain youth sports that are low touch and all of which have to be outside. No indoor youth sports at that point. So these are our goals. These are the dates that we want to hit. Again, well, this is the schedule I want to make happen. One thing and one thing only sets the schedule in the end, and that's the coronavirus. Any peak that we see, any cause of major concern, we are all going to have to be willing to pause. And all of this is in our new testing and contact tracing world. So if we want to reopen, we got to be committed to, first of all, picking up the phone when you see it's a contact tracer, and then saying, well, person I know was positive. I know I've been in contact with them. It's my duty to do the self-quarantine to make sure that we can continue to safely reopen Kentucky. It's going to require us to feel that duty again of saying, even though I didn't do anything, I came in contact with someone, and I know this is something I have to do for my state. That's going to be a big challenge. But I believe, again, that we're up for it. And then things we want to see in Phase 3 that we hope is in July is getting to groups of 50 people. Remember, we're going to be able to see on May the 25th, socially groups of 10 or less. All this schedule can change depending on what we see through June, but right now this is what we see as part of Phase 3. We will be working as fast as we can to get out guidance on these different areas, but we're trying to do it safe. We're trying to be inclusive of people's ideas, so understand it takes a little bit of time. Now, to do this safely, we need testing. And as you've seen, we have ramped up our testing capacity significantly, and I don't think our total number of tests are accurate right now. But through just the state portion of drive-through testing and a hospital program. And then tomorrow we're going to talk about a targeted long-term care facility testing plan. It is very aggressive. We have the capacity to do up to 30,000 tests per week here in Kentucky as we move forward. That is capacity that we have purchased, and it's our job to make sure that we get it all out there. But we have more partners that are joining us in this battle. A big part of being healthy at work is being able to get tested when you need it. Will you go back to the top 10? It's one of the main requirements we need to meet to reopen our economy and to get back to work. So the question is, how do we meet the testing plan? How does a small business, how does a medium or large size business know where to send people or who to work with or what relationship to establish to make sure that if somebody comes in, you scan their temperature, woo, they got a big fever. You don't want them to just go home. You want them to get tested so you can know as quickly as possible. So we've been working hard on a solution with the private sector that will significantly increase our testing capacity at a time when people return to work and return to worship. So today, I can announce a new partnership with First Care Clinics. First Care Clinics have 13 locations all over Kentucky and will offer drive-through testing 7 days a week aimed at serving our business community, our faith communities, and government offices as they look to reopen. Our vision for this partnership with First Care is that it becomes the place that folks go to get a test if they're going back to work or they need to be tested through work. We're working with the Kentucky Chamber of Commerce, the Kentucky Council of Churches, KACO, KLC, County Judge Association, and others to make sure that people are aware of this opportunity in their community. And First Care is working on a way to communicate directly to employers all over Kentucky to say you have an avenue here. In this new world where testing is so important, we are here. You can use us. First Care accepts private insurance, Medicare and Medicaid, and most plans have waived copays, meaning the employee and the employer won't have to pay anything in virtually all of these circumstances for the test. This is one of the first fully private models that is up and is operational. For folks that might not have insurance at this time, First Care also enrolls patients into a federal coronavirus testing program that covers the cost of the test. So in addition to the business community, churches, government, they offer other tests that you can get right here. If you don't have any insurance at all and because of that, you haven't been going to get tested, they can sign you up in a program. You won't pay anything at all. Anyone can get a test. Because so many people who get the virus are asymptomatic, you don't have to show symptoms to get a test. First Care has clinics in Henderson, Hopkinsville, Madisonville, Shepherdsville, Bardstown, Danville, Frankfort, Winchester, Somerset, London, Corbin, Pikeville, and Middlesboro. First Care is partnering with Solaris Labs. That's when I talked about the other day. All of our lab capacity is homegrown. It's 3 groups. I'll let Dr. Stack talk about the third, but Gravity Diagnostic and Solaris, which are doing a great job, and 2 research universities coming together and meeting, not just meeting, exceeding what the White House is setting out as what we need to test each month. We are absolutely going to have the capacity. Solaris Labs is in Nicholasville, and it's a company that stepped up in a big way to help Kentucky. They have the capacity to do 120 tests a day during the week at each of 84 locations, meaning that we're adding 10,000 tests a week to our capacity. That means we should have the ability, as long as we can deploy them, to do at least 40,000 tests just through Gravity and then Solaris. For more information or to sign up and schedule an appointment, the information is on your screen. And as we'll show you in a minute on our website, you can see all the different places you can get a test. Folks, this is big news. In our new world where testing is so important, and where we all lived through that time where I had to say, if you're doing okay, don't get a test, that's not the case anymore. Get a test. You feel just a little bit sick, get a test. You're wondering if it might be allergies, go get a test. You're just worried about your family because you're going back to work, and you know you have more contacts with people, get a test. It is there. It is available, and it can help protect you. Now, we have one other new lab partner, and I'm going to let Dr. Stack talk about this one. But, the way I see this is there's now no excuse. You're running a facility. You have 3, 4, 5 people that have tested positive. You might have an outbreak. These are partners that you can work with to test those entire facilities. So this resource is here. Big business, medium-sized business, small business. Doesn't cost you a dime in most instances. So now we all have the tools to do the right thing and protect one another. Steve?
Thank you, Governor. So I'm going to extend and build on what the Governor just shared with you about testing. So this is foundational to us all getting back to being healthy at work and healthy in our regular lives. So the Governor talked about first care urgent treatment centers where you have options throughout a number of communities. I think they have 13 sites in Kentucky. They have a couple sites outside of Kentucky. If you could show my next slide, James, please. I have spoken over the last few weeks with laboratories and healthcare providers, and it's a complex undertaking. We're trying to build an entire infrastructure for a single disease, unlike anyone we faced before. And so Blue Water is one of the other labs the Governor's mentioned from time to time, and I have. They're out of Louisville, and they have the ability to provide testing. So they already provide testing through 2 locations in Bullitt County and Johnson County. In addition to that, they have the ability to go do testing throughout the state. They have about 35 people apparently they can deploy throughout the state to do testing. A number of these things just require the people who need the testing to reach out and connect with people who can provide it. We're trying to share this information so you know it's available. Blue Water's contact information is at the bottom here, and I encourage you, if you're a business, if you are an individual who needs testing, if you need to arrange this for your for your workplace, contact them. They're ready. I know they have plenty of capacity and they have the materials they need. And like the Governor has said, if you have insurance, co-pays and patient portions should be waived for these things. That was in federal legislation. If you have Medicaid, this will all be covered at no cost to the patient. If you have Medicare, it will be covered at no cost to the patient. And if you are uninsured, the federal government has put in place programs so that a lab and a provider for a test can just register you and get that paid for too. So it should be something that one way or another everybody can get access to. So thank you to Blue Water, who's talked with me over time. James, can you show the one other thing? Governor, I think this is what you were mentioning. On our website, on kycovid19.ky.gov, we now have a map. The map shows 72 sites at the time I walked up here to speak to you tonight. There is an area on here for any healthcare provider or site who is offering testing. You can click the link, fill out a form with the information, and when you click submit, someone on our end will review it, and as long as it all looks okay, they will post it up here. Please, if you offer testing and you're not on here, I hope to log in tomorrow morning and find there's 100 or more people who are offering testing here. And the final thing, we have expended a great deal of effort working on special settings. The Governor will give an update tomorrow. Talking about long-term care settings, nursing homes, elderly communities, where we're expending a lot of resources and have built quite a comprehensive program to try to be very aggressive and test those areas. As you've known, we've worked with prisons. The Green River Correctional Center is the one that we've talked about most recently. And I've been spending a lot of time now working with the meat processing industry directly with one specific facility, but we have local health departments and the Kentucky Department of Health working with a number of facilities to try to make sure we address their unique needs and are supportive to them. Ultimately, though, we need to start having the private sector work in partnership to build the solutions for this. So we're doing the best we can, but we've talked to the Kentucky Hospital Association, others have talked to the Kentucky Chamber of Commerce, and others about the need to bring labs, people who can collect specimens, and bring them together with employers who are going to need to do large-scale testing. We'll keep hard at work at that, but we thank the private sector for all your efforts too. Together we'll get through this. And Governor, thank you very much.
Thank you. I think Steve forgot we'll get through it together, but we're certainly getting through it together. Let's remember, first of all, look at that. From where we've come from. It's May. And we first learned about this virus tail end of December, January. We had our first case in March. And we have 72 locations right now where people can get tested. This is one of the reasons I believe that we can do healthy at work. This is one of the reasons that I believe that it's going to be tough, and we're going to have to be smart, and we're going to have to be gradual. But with this capacity, when you think about the 3 partners we talked about, it's a potential for over 50,000 a week right there. You look at that, that's a potential for 200,000 per month, and what the White House wants us to hit is 88,000. Now, 88,000 sounds big when you look at the total number of tests we've done to date, but the capacity has changed very quickly. So I think our new challenge is going to be deployment, and is going to be encouraging people to get tests, and when they need to get tested. So let's remember our big Kroger drive-in sites for next week are in Louisville, Lexington, Corbin, and E-Town. And to give you an idea of signups for next week, we still have about 80 spots in Lexington for Monday. We have almost 300 spots in Louisville, Lexington, and Corbin on Tuesday. E-Town actually booked up full on Tuesday. Good for you. And then on Wednesday, Thursday, and Friday, significant capacity in each of these. So in any of those areas, go ahead and get online. This is how you register. Make sure if you sign up, you actually go. We don't want any more no-shows. And so as of about 4 o'clock today, we've done 279 in Louisville, 348 in Lexington, 269 in Bowling Green, 283 in Ashland. And if we continue at that pace, we're going to do almost 5,000 just from those sites this week. So excited about those opportunities and grateful to every group across Kentucky that's doing this testing. Until we get a vaccine, this is our future, and you're stepping up and you're making it possible. Also, really exciting news today about expanding capacity for coronavirus testing awards. We've received $10.3 million for 25 Health Resource and Service Administration funded health centers. These are health centers that are going to use funding to expand the range of testing and test-related services and activities to best address the needs of the local communities. Funding for health centers is part of the Paycheck Protection Program and Health Care Enhancement Act signed into law by the President on April 24th. And we have a chart of some of the places that are getting these dollars. They go from Brownsville to Owensboro, Prestonsburg, Lexington, Bowling Green, Greenville, Burkesville, Louisville, Gray, McKee, Lexington, Covington, Beattyville, Hazard, Richmond, Vanceburg, Prestonsburg. Again, 2 separate ones. And Mountain Comp is the second one. Whitesburg, Louisville, Hopkinsville, Providence, Mount Sterling, Warsaw. So again, just an example of more funds coming in for programs that are out there. There were days during this where we wondered if there would ever be more testing. There were days where we wondered if we could ever secure PPE, and days are getting much better on those fronts. Separately, we have been able to, again, those are locations, we've been able to announce $22.9 million in Kentucky Transportation Cabinet funding through the CARES Act. That is here, and it shows you all of the counties all over Kentucky that are going to be receiving significant funds for transportation, especially mass transit, busing systems, and the like. This is just going to be a little bit of help with all the different things that we have to do to now clean those buses and other forms of transportation. Again, it is helpful as we move forward. Now, while that funding is exciting, we continue to see scams out there trying to take your money. And so I want to just briefly mention a utility scam where people are getting calls from someone claiming to work for the electric company and threatening to disconnect their service without immediate payment. They cannot do that. In March, I issued an order that halts disconnections and fees for late payment on utility bills during this crisis. So if someone is calling and telling you they're going to disconnect, they are a fraudster. Hang up. Don't listen to them, and certainly don't pay them any money. I feel like the Attorney General again. But this is a very important step, because at a time when I know we're all struggling just to get by, you may have lost a job. We don't want you to lose any more money, and you can call the Attorney General's Consumer Protection Hotline at 888-432-9257. We're in the test of our lives. Let's make sure that we don't let somebody take advantage of us during it. Let me just check my notes, because those may be our updates. A lot of updates today. A lot of news about how we move forward. Some positive news on testing. A tough day in those we've lost, but we're going to continue to have those. Tomorrow, we're going to go over our plan for long-term care facilities. Secretary Freelander is going to lay that out, and then we can answer questions on that. So we've got 4 of our journalists that are here. We got Tom Latek, Morgan Watkins, Lawrence Smith, and Stu Johnson. And we'll go back and forth between written questions and questions here. And so give me time to take a drink. Tom, why don't you start us off?
All right, thank you, Governor. Chief Justice Minton has 3 task forces on how to reopen the court system, district, circuit, and the appellate level. Are you working with them on this aspect of reopening government?
The question is, am I working with Chief Justice Minton and AOC on their plans to reopen government? Yes. Both my staff is working with them directly, and I talk to Chief Justice Minton pretty frequently. It's been a very positive relationship. He has very much wanted to do the right thing. And I think what we're finding in state government and what they're going to find in the justice system is we're going to continue to do a lot of things virtually. Even after the vaccine, we're going to do a lot of things virtually. There are a lot of efficiencies there, whether it's transport for certain hearings when you're looking at the justice and the criminal justice system, whether it's large parts of CHFS that are more productive at home. We didn't know. We were forced to I guess, take this experiment, but every time that we can learn in this world about telework and how it works, we ought to take every positive we can from it. What have cities and businesses told me remain the biggest challenges as they prepare for phase 1 of business reopenings on Monday? I think it's the cleaning, and I didn't know that would necessarily be the one, because a lot of cleaning that we do is surface cleaning. And outside a pandemic, that'd be fine. Maybe in flu season you would want a little bit more, but this is bigger, and we got to make sure that we meet it. A little bit of it is the PPE, figuring out how to do the temperature checks. But I'll tell you what I think is the biggest challenge. It's strongly encouraging those that are still in that vulnerable population, 65 and up, heart, lung, kidney disease, not to come back. That doesn't mean don't come back ever. What it means is I know that work is a big part of who we are, but it is still dangerous out there. The president still suggests that you shelter in place, and I'd ask you to do the same. Lawrence?
Two-part question, Governor. You mentioned you moved up the restaurant. You were originally talking about June. Why did you move it up? And second part is you mentioned campgrounds. What about pools?
Two-part question that don't have anything to do with each other, but I'll answer them both. The first was moving restaurants up. What pushed me to do that? Well, we were looking at it the whole time, but my conversations with Mike DeWine were a big part of it. Indiana is already opened to an extent, Tennessee, and with Ohio going around that time. The best way at that point I think we can protect our people is to make sure at about that time, with restaurants having enough time, we're also able to open up, and we've just got to work to do it the very best we can. We had planned it for a little bit later, but I think that this is partial harm reduction, and also the belief that those that we have worked with sincerely want to do this right, and that only want to reopen if they can do it right. Now, I'm telling you, or I believe, that many will find that they won't be ready for that date. Don't rush. If you rush, you don't do it right, it spreads the virus. Nobody's going to want to come back to your place anyways. And we want to protect each other, so let's make sure we do it right. Second one was we talked about campgrounds. What about pools? We need to see what happens with the virus, especially as summer comes. You cannot socially distance in a pool. I mean, it's when we see whether it's public pools or apartment complex pools or the rest, all the things that we're doing and allowing, we're still asking for social distancing. And we have to be able to look at the reality of that in certain places and in certain areas. Phil Pendleton, they did an analysis and discovered recently the number of cases skewing towards those in the under 50 age group. Do we know why this may be happening? Because anybody can get the virus, and we are testing more people without requirements. It used to be they had to be certainly over 50, or you had to be sick, or you had to fall in a vulnerable population. Now that it's open, we're testing significantly more people of all ages. What that means is there's a lot of asymptomatic people out there. You feel great, but you have the virus, and you can be spreading it. Knowing that, I'm pleading with you, wear a mask in public. Not in your home, not when you're going for a run, but if you're going to go to the grocery store, knowing all the ages that I just read out. Just make sure that you're not the person that coughs in a given direction or touches something that other people then come by and touch, and you unintentionally spread the virus to someone whose body can't handle it. Stu.
Governor, you said that tomorrow night you're going to talk more about the sector about long-term care, but you did say earlier tonight that you've seen less growth in cases.
Just tonight.
Yeah, I was going to say, is that enough for a trend, or is that?
The question is on long-term care, and we've had some fewer cases the last couple days than before. Do we believe it's a trend? I think it's too early. But at some point, we would expect for some of those numbers to stabilize. But with this extensive testing we're going to do, those numbers are going to go way up just because we're going to test everybody. And when you haven't tested anyone in a given facility, and we're going to go in, and we're going to have to triage how and where we go. But we're going to have a lot of asymptomatic people that are doing just fine in these facilities, and they're going to be just fine, but they're going to test positive too. So what we're going to have to do, and it's like when we look at the total cases right now, and we have to say how many of these are in prisons, right? And do we have a big pop in one day? Why? It's because we tested an entire prison. How many of these are in long-term care facilities? How many are in the general population? We're now to the point where we got to dive down into the numbers. So at some point it'll be, how much is it affecting people in certain facilities? How well do people do if they can be moved to a COVID wing of their own facility and still cared for versus another option? And this is a battle we're going to be fighting until there's a vaccine. So it's one we got to dig in, and we got to be ready, and we got to do a really good job. Story regarding college preparatory summer programs, Governor Scholars Program, Governor School for the Arts, Governor School for Entrepreneurs. Will guidance be issued for these programs? I believe some of these programs are going to make announcements soon. It is certainly too early to say that we will be able to do them. They bring a lot of people together. You heard some of the ages that I read. If we're going to do them, I have to believe we're going to do them safely. I was a Governor Scholar. I'm the first Governor Scholar to be governor and be able to make these decisions. I would not be able to live with myself if I allowed something like that, knowing that it could spread through everybody very quickly. We've just got to make sure that it's safe before we do it. These are kids that have a huge, bright future in front of them. We don't want to make a decision that halts that future or makes it more difficult for some of them. Morgan.
One of the kind of guidelines you guys have put out for businesses is that to safely reopen, a lot of them are going to have to get PPE, masks and gloves and things like that. Historically, over the last couple months, getting PPE has been really hard to the state, which obviously has more resources than the businesses. How are you expect? It sounds like has it gotten easier to get PPE, and also is there going to be any way to verify that the businesses that are understandably anxious to reopen have what they need, or is it kind of an honor code?
Can you put up the chamber slide. So the question is about PPE needed for business to reopen. So we now use this phrase PPE that none of us knew before, and I say it probably 30 times an hour. We use it to cover a lot of things. We use it to cover everything from this, a cloth mask, to an N95 respirator, to all that stuff that it makes it look like, you know, you're walking on Mars by the end of it. So it covers everything from the lightest that you would need to working on the most infectious of diseases and what you would wear. So the PPE for most businesses that are going to be reopening, certainly on Monday or even when we hit retail, is very light and is very simple, involving cloth masks that can be made at home. We have a slide that is up there. But we've also got a partnership with the Chamber and Distillers to address masks, which is the most needed, as well as hand sanitizer. We started with an initial purchase here that the Chamber is doing, and they've already gone through it, and they've already got another big set up. This is especially helpful for small business. Now, if you are a facility, you might be a certain type of manufacturing facility where people are closer, or what you're doing brings more people in proximity in a large building, there may be more PPE you need. But you likely needed much of it before. And so those supply chains should be there, and the private sector is going to have to step up on that supply chain, because we as government have to be the backstop for healthcare, for nursing homes, and to prepare for a next spike. But some businesses aren't going to be able to reopen on the day that they say, because they don't have enough PPE, and they need to work to get it to safely do it. Is it fair? No. But the coronavirus just doesn't care about our norms and fairness. And at the end of the day, we have to do the right thing to save lives, so some may have to open just a little bit later. There's a question of why did we move gyms to phase 1 when certain people have gyms open? Nobody should have a gym open right now. Nobody should. If somebody has a gym open in a city, in a place, it's in violation of the orders. Now, we set it up for June, and we're going to be working with those facilities. We want to make sure that we get a really good plan based on the length of time people stay and the activities that they're in. This needs to be a very good, safe plan. So to those that run these facilities out there, I know you've been waiting a while. I know you had uncertainty because we didn't have it up there. What we'd ask is work with us for that June date to make sure we can do it safely. You now have some certainty. Now let's move from certainty to safety and make sure that we can do this right. Tom.
Thank you again. This may be more a Dr. Stack question than a Governor Beshear question, but for those of us who wear glasses, how in the dickens do you keep your glasses from steaming up when you're wearing the mask?
It's just a challenge.
It's a challenge. Someone told me to take Dawn soap, wipe it
Yeah.
off, or wipe it off.
So,
I'm going to try it tonight.
so we're talking about our new normal, and if you wear glasses like I had to for most of my life, how a mask can steam it up. We'll be coming up. We'll help with that. We'll help with some videos and some instruction. Now, these little things aren't little. They're important, and we want everybody to be as comfortable as they can be, even when they're uncomfortable. I think I mentioned the claims that are unresolved left in March, about 14,000. Are they being prioritized over April claims? At this point, these are challenging claims that would always have to go through these last 14,000, a longer appeal process. So they will be in that process, while April claims and early April claims now become the priority to get processed through. I want to get the governor's reaction to reports that the White House spiked CDC guidance to local authorities on reopening. I think that's maybe the news today, that they rejected some CDC guidance. I'd like as much guidance as we can get from the CDC to at least give us an opportunity to see what our public health officials agree with. Regardless, I'm lucky to have Dr. Stack and so many other public health officials that can help us get the right guidelines to open safely. Lawrence.
Senator Rand Paul says you're intoxicated with power. And he wants the General Assembly to take action to curb your executive authority, says you're going too far. Would you respond to that?
Yeah, Lawrence says that Rand Paul has said today that I'm intoxicated with authority. I promise you this is water. You know, there's still some partisanship and some politics going on right now. I'm just not doing it. I'm just not doing it. I have to make decisions every day, trying to get this reopening right, knowing if we don't do it right, we'll lose more people, meaning more people will die. That's what I do on a daily basis. So the last thing I want to do is go back and forth with somebody. I think everybody who watches or who has watched this knows that I've made the decisions that I've made because I care about each and every Kentuckian out there. I truly care, and reading off those that have died every day is the hardest and most painful thing that I have ever done. I look forward to getting to the day where we don't have an emergency clause. I look forward to the day where I don't have to enter orders that restrict things that we do. But right now, we have an aggressive virus out there, and while there are those that'll hold a rally saying, take off your mask and don't social distance and I'm not taking a vaccine, I know the rest of us are committed to doing what it takes to defeat it. Here's a question. Many Kentucky National Guard members were checking out of their downtown hotel they've been staying in the last month. That is because many of our missions that we have been doing, we are able to decommission. For instance, we were providing some assistance to hospitals. We're no longer having to do that where we are right now. The staffing from the field hospital, we've stopped. We've got the entire field hospital in Louisville in place to reopen at any emergency, but staffing it day by day we don't have to do right now. We still have a number of Guardsmen and Guardswomen that are very active. Stu.
Another mask question. There's been obviously a lot of attention into how the mask can prevent the transmission of getting off the virus, but I think it's still unclear as to what kind of protection from obtaining the virus with a mask has.
Right. So the question is about the science that's out there that is now saying very clearly that wearing a mask can help prevent you or lessen the chance that you, being asymptomatic, spread the virus to someone else. It's still unclear how much it might protect you personally as an individual. You know, having something over your mouth and over your nose can't hurt on that. We will wait and we will see exactly when the studies come out. But I'll tell you, our Director of Public Health is wearing one right now. That's good enough for me. Morgan.
You clearly understand that, you know, the possibility when you reopen things that there could be another spike. You were talking about that earlier.
Yeah.
And, you know, with Kentucky being at a plateau, it looks like, but not on the decline, are you looking at the possibility of, you know, making contingency plans to potentially have to issue orders to shut things down to reopen again? Are you talking to businesses about how that would affect them? Because I've talked to a couple of economists who said that the reopening only to shut down again fast can actually hurt them more than waiting longer to reopen.
Yeah. So the question is, with us having plateaued, but not necessarily seeing a great decline in cases, though I think when we get all of the tests in, we will see that our rate has decreased, though we're also testing in some areas where we know we're going to get a lot of positives. So there's a lot to get through in the data. What I'm confident of is we are not seeing a growth in cases across the Commonwealth, that it is not accelerating, that we are not doubling in a number of days that we see either in the Philadelphia or in the St. Louis graph. But with that, what type of concern do I have? There's a spike. What would we do about ordering closures? Our goal in having a gradual plan is to be able to pause. And that would be our first step. If we saw a spike, we would pause where we are, right? We would look at where we've seen them, what type of businesses that we have. We would try to be surgical on those areas. We now have the ability and partners to go in and mass test in one area. And that's likely the step that we would take. We wouldn't move to that next step, that next week, that next phase, and we would then look at it from there. The gradual reopening, allowing other states, if they're making big mistakes, to make them first. If they're just getting a 2-week head start, on reviving their economy, I would rather know than be that canary in the coal mine. Let's see. Is there a plan for fairs, local and state, and the state fair? Again, we're going to have to see what is going on, especially with summer when this hits. Right now, a state fair, which is always going to be more than 50 people, which we're talking about in July. County fairs are really concerning. And I think our local leaders, when they think through how people come together in county fairs and the cleaning that would be required. You know, each ride, each time, each game that's set up, it would be a real challenge. And at this point, we can continue to think about what we could do later in the summer, but I just say we're all asking these questions because we want a normal summer, and we're just not going to have one in the midst of this pandemic. But if we do this right, next summer can be pretty normal. We ought at least to have a vaccine by then. I hope we do. And if we do this right, it means next summer we have a normal summer. More of us will be there to enjoy it. Real quickly, a question on JBS in Louisville. The local health department there, which is a great one run by Sarah Moyer, has been working directly with them. We are, through partners, going to try to make testing available on the private sector side to them to do everything up to test the entire facility. And we're going to be doing that everywhere now that we see one of these outbreaks. With all of the labs that we have, with all of the hospitals and the partners that we have, there shouldn't be an excuse anymore of we just can't test anybody. Yes, you can, and we will work with you to make it happen. All right, we're just a little over today. A lot of big news, a lot of excitement about our testing capacity, but still a very dangerous virus out there. Remember those ages of people that I read that have it. Just because you're in your 20s or 30s doesn't mean you're invincible. This thing can really hurt, and you can spread it to other people. So let's remember, as we get to Healthy at Work, we got to protect one another. We got to be really careful. We got to follow the rules. And oh my goodness, I wear this because I believe that it helps me save someone else's life if I'm asymptomatic. So I'm going to put it on, knowing that I'm passing my test of humanity, that I'm living my faith, and I'm protecting my neighbor. Thank you all very much. See you at 5.